All right, sorry for that particular mix-up, but I'm just about to bring you that story that is brought to us by Yvonne Kemuma. Now, occupational therapy is considered as treatment for children living with neurodevelopmental disorders like autism and cerebral palsy. Over 75% of children with neurodevelopmental disorders show significant improvements through this type of treatment. Tonight on our special feature, our reporter Yvonne Kemuma takes us through the nitty-gritties of occupational therapy.
Every child's journey is unique, but for those born with neural developmental disorders, the path can be challenging. These disorders include a wide range of conditions, from autism spectrum disorder to attention deficit hyperactivity disorder, ADHD, cerebral palsy, and many more. Each condition presents its own set of unique challenges, but there are common threads that bind them all: the need for therapy. Occupational therapy is beneficial for a wide range of disorders and conditions that affect a child's ability to engage in meaningful daily activities. But first, what is occupational therapy?
Okay, occupational therapy is a science that deals with patients who have got limitations that limit them from doing things physically or mentally. Basically, we use activities to help people to achieve their goals. So, and we also use something we call occupations, where occupations are the things that you do from when you wake up to when you go to sleep.
As neurotherapist Edith Kagendo of Peak Neurohub and Orthopedic Center describes, the process of providing therapy involves bridging the gap between the child and their environment.
It means this child will not develop normally. So in the absence of all this, an occupational therapy comes in to bridge the gap between the environment and the child, so that you teach the child how to manipulate and play with the environment for them to enjoy full stimulation of the environment. Because we say you are shaped by the environment you live in. Even a child, it means that what they see is what they learn from.
When dealing with neurodevelopmental disorders, diagnosis is a comprehensive process. Ideally, it begins at home with the caregivers, then advances to the medical setup, where healthcare professionals further assess the situation.
They can see maybe the other child I brought up was never like this. The other one maybe started sitting at this time. This one is not sitting. So it can also be done by family members, and especially the mothers. Mothers always have this instinct of feeling that my child is not doing this. What is wrong? So the curiosity of the mother can also help come to realizing there is a problem, to identify, but the actual diagnosis is supposed to be done by the professional.
But while therapy can be immensely beneficial, it is important to acknowledge that it comes at a price. For some families, this cost can be a barrier to accessing the therapy their children require. It is in such situations where organizations like Radiators Foundation come in to bridge the gap. Early Saturday morning, Rodan Thenya, who currently resides in Mlango Kubwa, makes her way to Madare Radiators Foundation to bring in a grandson for his weekly therapy session. Rhoda describes to us her gratitude for the milestones that her grandson has achieved thus far with the therapy.
Kama ameketi kwa kiti, anaweza jiteremsha na asimame na ajishikilie hapo. Anaweza shika kitu, mbeleni angeshika kitu, akishika anaachilia. Sasa hii anaweza shika. Sasa ile shida ilikuwa mingi ni hii miguu akisimama inakaa hivi kombo hivi. Sasa ndio nikaelezewa tununue hizi viatu. Sasa ndio tumenunua tu hii mwezi. Sasa ndio nione venye itaendelea.
Rhoda narrates that the cost of therapy was initially too high for her family, noting that the free sessions offered at Radiators have lifted the burden of finances significantly.
Ni ngumu kama hizi viatu tulielezea kwa kitambo huko Januari. Ikakuwa ngumu kununua wiki hata ni 4,000. Hata tulikuwa tu tunachanga pole tunachanga. Msichana anafanya tu kazi za nyumba. Akipata anatuma. Tunanunua chakula, hata kununua chakula yake inakuanga shida. Akikonjeka kama juzi anaumwa na meno. Meno zinafura. Inatakiwa apelekwe hospitali. Tukaitisha pesa mingi bado hiyo tumewacha.
Edith described the treatment plans as specific to each condition and are tailored to suit the children's age and the milestones required for each child.
So you find like a child with microcephaly will have maybe a very small head. You are able to identify that. Then you can find maybe a child with Down syndrome will have like the droopy eyes, a nose that is lowly placed with ears that are lowly placed. It will maybe have a crease on the hand. So the professional is able to identify these things because we are trained to identify the normal versus the abnormal.
Kenneth Apopa, CEO Radiators Foundation, underscores a great gap between the abundant opportunities for disabled individuals and the limited access due to insufficient investments in education and therapy. He says organizations like Radiators, which are vital for bridging the gap, currently face a challenge of inadequate recognition and support.
Radiators Foundation is youth-led and youth-founded. As you can see, we are young people who are out here trying to make a difference. Our work heavily relies on the power of giving and also on the power of volunteering. All our therapists and our staff are volunteers, young people who have chosen to not sit back. They have chosen to use their little time and talents to make a difference in the community. So during the week, some of us work in different establishments, but then during the weekend, specifically for the children of Mathare who have disabilities, we come together every Saturday of the weekend to make sure that they receive all these services for free.
On her part, Rhoda calls for more well-wishers to continue aiding in such noble causes, as she encouraged mothers with special children to continue seeking professional services for their children.
Nataka tu kama kuna wale wanaweza jitolea kusaidia kwanza kwa matibabu tu, ndio inakuanga ngumu, na kama na wale wako na watoto kama hao wasikufe moyo, waendelea tu na kuwaleta therapy. Kwanza hapa tunashukuru sana UMIS, hitishwangi chochote, nafanyiwa tu free.
Another important aspect is corporate social responsibility, which is a crucial aspect of businesses contributing positively to the society. Peak Neurohub Treatment Center recognizes this significance and has a comprehensive plan to actively engage in social responsibility initiatives.
So for this particular place, that one, anyone wanting to do the consultation can always come. Yes, we also have what we call a CSR, corporate social responsibility. So in this particular clinic of ours, out there, we do once in a while, maybe once a month, but pre-arranged. We seek and assess clients who would not be able to maybe access services because they cannot be able to pay.
The journey of reconciling children born with neurodevelopmental disorders is a multifaceted one. Each aspect contributes a story of hope and resilience. Yvonne Kemuma, KUTV, Nairobi.